Hello, we're from SGD B10 and will present about septic arthritis. These are our members, and this is the outline.
Hello, my name is Aurelius Novito with name 128. Septic arthritis is a rheumatologic emergency that might lead to disability or death. Septic arthritis is an uncommon disease with only 4 to 12 incidents in 100,000 person years. Septic arthritis is considered as poorly studied, for there is no randomized treatment trials yet. Small joint septic arthritis is more purely understood than large joint septic arthritis because most studies are biased towards large joint septic arthritis. The clinical and laboratory diagnosis is not that straightforward. High-grade fever is only present in 58%, and serum leukocytosis is only present in 50 to 60% of patients. Not only that, joint pain symptom is minimalized with immunosuppressed patients. These statistics and difficulties in clinical and laboratory diagnosis means that there is still work to do in understanding septic arthritis. This paper is made with the intention to understanding more about this uncommon disease and thus possibly engage more studies to analyze this disease and induce more treatment trials so patients can get a better medication for septic arthritis. Thank you.
Hello, my name is Kriseta Paramita Karimaya with name 170. The purpose of this reading is to find the answers for such questions including first, what is septic arthritis? Second, how is the epidemiology? Third, how are the etiology, risk factors, and complications of septic arthritis? Fourth, how is the pathogenesis and how to prevent the disease? And lastly, how to diagnose and treat septic arthritis. The benefits of this writing are medical community and public can be more informed about septic arthritis, which will help the public to seek medical attention at the right time, thus reducing mortality rate. Third, more treatment and general studies of the disease will probably emerge as a result of knowing of how understudied this disease is. And lastly, authors can enhance their knowledge about septic arthritis and also fulfill student project assignment in the Musculoskeletal System and Connective Tissue block of Faculty of Medicine, Udayana University.
My name is Komang Yuniputri, number 031. The definition of septic arthritis. Septic arthritis is a disease of the joints that caused by inflammations. The inflammation is caused by an infections that occur are generally because of bacteria, but can also because of fungi, mycobacteria, virus, or other uncommon pathogens. Septic arthritis is generally monoarticular, involving one large joint such as the hip or knee. However, it is possible that septic arthritis can occur polyarticularly, which can occur in several joints. Septic arthritis is considered an orthopedic emergency which can result in significant joint damage, which can lead to increased morbidity and mortality.
Hello, my name is Anil Sharma with name last digits 251. And here I'll be explaining about the etiology and also the risk factors for septic arthritis. So the etiologies for septic arthritis varies between the age of the person. In active adolescents who are sexually active, it's caused by Neisseria gonorrhea, Staphylococcus aureus in adults. In neonates, it is usually caused by Group B Streptococcus, Staphylococcus aureus, Neisseria gonorrhea, and gram-negative bacilli. In neonates which are between the age less than 2 to 3, it is usually caused by Kingella kingae, and overall, septic arthritis is caused by Staphylococcus aureus. The risk factors for septic arthritis includes existing joint issues, having an artificial joint, medications for rheumatoid arthritis, skin fragility, a low immune system, prolonged antibiotic therapy, trauma with infections of the abdomen, abuse of intravenous drugs, and also leukemia.
Hello everyone, my name is Madeline and my last registered number is 093, and now I will discuss about the pathogenesis of septic arthritis. There are some ways or causes that can cause septic arthritis. For the examples are direct injury, wounds, prosthetic joints, and intra-articular injections. And the most common cause are microbial infection of joint via bloodstream, or it can be called hematogenous, or maybe contagious spread or direct inoculation. This will induce inflammation and resulting joint destruction. For the pathogenic infection, synovial membranes will increase adhesion factor and exhibit neurovascularization, and this condition will increase the potential of bacteremia, and it can result in joint infection. Thank you.
Good afternoon, everyone. My name is Marco with name 057, and I presented about the clinical manifestation and diagnosis of septic arthritis. The clinical manifestation of septic arthritis include acute symptoms such as reduction in range of motion or ROM, joint motion, specific pain in the region, tenderness, and inflammation. Those symptoms usually come together with fever. However, in illness may show only irritability in joint motion without fever. Septic arthritis in knee and hip generally are found most likely in older children and adults, whereas in illness are found septic arthritis in hip and shoulder joint. Patients with PGI shows more symptoms such as illness in the affected joint, inflammation, and fever in surgical lesions. Next. The diagnostic methods, the first one is imaging, whereas this method identifies septic disease with approximately sensitivity. Ultrasonography and MRI could be used in this method, although they are not highly suggested to be used in routine. Next. Next. Okay. Second one is lab studies. The first, peripheral blood test, which is blood culture. The second one, synovial fluid analysis, which is a gold standard. And the third one is a white blood cell count, which has a 90% of sensitivity and 40% of specificity. And the last one is a microbiology analysis, which is simple, fast, and low cost. Okay, thank you.
Hello everyone, my name is Putri Emilia Dewi with student number 028. So I will explain about the differential diagnosis of septic arthritis. There are many differential diagnoses of this disease. Like the first, we can rule out the Lyme arthritis with Lyme IgG Western blotting. Next, there's transient synovitis that can be ruled out with a trend in elevated CRP or preceded by upper respiratory infection and a febrile in child. And the third, we can rule out the juvenile idiopathic arthritis or JIA that usually polyarticular and migratory. Next, fracture or structural defects that can be ruled out with ultrasonography or radiograph. Next, leukemia or sickle cell disease that can be ruled out with peripheral blood smear. And the last one is superior-sterile abscess, cellulitis, osteomyelitis, intramuscular abscess, pyomyositis, tumor, and the other soft tissue lesion that can be ruled out with MRI.
My name is Igman Wigaha Yoga, NIM 109. I will explain about the treatment of septic arthritis. There are two steps that must be done. First is antibiotic and joint drainage. For the antibiotic, it depends on the region. Some regions have high prevalence against methicillin-resistant Staphylococcus aureus. In those regions, the patient will be given vancomycin as the drug of choice. In other regions with lower prevalence, the patient will be given cefazolin. For the patient with high risk of infection, they will given additional cefepime. And the second step is joint drainage. Joint drainage is necessary because it can decompress the joint and take out any remaining bacteria in synovial fluid. There are several ways to do joint drainage: arthroscopy, daily needle aspiration, or open surgical drainage. Each method has its own strength and weakness. So, to choose which method will be chosen, it depends on the situation, like the location of the infection, the duration of treatment, and the availability of equipment.
My name is George David. with student number 19.025 11.074. So complication and prognosis of septic arthritis. The complications of septic arthritis are osteoarthritis, osteomyelitis, and avascular necrosis of femoral head that leads to dislocation of hip joint. The prognosis of septic arthritis, if early investigation and treatment can reduce poor prognosis, but it can develop slowly. A long-term follow-ups, 1 until 2 years, is needed to detect or remain symptoms. That's all for the complication and prognosis. Thank you.
Hello, good morning, doctor and friends. My name is Shannon Kalista, NIM 015. Now I will continue the presentation. So, based on the etiology and risk factors of septic arthritis, there are some prevention that can be done to avoid or reduce the risk of infections, which can lead to septic arthritis, such as number 1, take antibiotic before invasive procedures to prevent infections. Number 2, do pay attention to inspect joints and skin for sign of infection. Regularly check the feet for sores and cuts that may lead to infection. Number 3. Steroid injection procedure, which are widely used to treat rheumatoid arthritis, should be sterile so that it won't contribute to development of infectious arthritis. Number 4 is to prevent other risk factors which can lead to bacteremia, such as animal, insects, and arachnoid bites. Number 5, it is best to minimize the use of intravenous drug, which is one of a common way to introduce foreign bacteria into the body, which later can lead to infectious arthritis. Number 6 is to eat a healthy diet that can help to support the immune system so that it can reduce the risk of infectious arthritis. And last but not least, use of a barrier contraceptive method such as latex condom to prevent sexual transmitted infection such as gonorrhea and chlamydia, which can occasionally induce infection arthritis. Maybe that's all from me. Next will be continued by my friend. Thank you.
Hello everyone, my name is Puturaya Natalia Andrani with student number 217. So the summary for this is definition of septic arthritis is joint disease caused by inflammation due to infection. And epidemiology for septic arthritis is most common in 61 until 70 years old. And septic arthritis is mainly caused by Streptococcus aureus and with risk factors such as existing joint issues such as osteoarthritis. And pathogenesis for septic arthritis is common by microbial infection via tree roots, by bloodstream, contagious spread, and direct inoculation. Diagnosis method for septic arthritis is we can use imaging, lab study, and microbial analysis. And the treatment for septic arthritis is by antibiotics and joint drainage. Complication for septic arthritis is osteoarthritis and osteomyelitis, and is due to early treatment is needed to reduce poor prognosis. Prevention for septic arthritis, we can prevent of the risk factor of septic arthritis and improve immune system.
So that's all from us. These are the references we used. Thank you.